here is what I want to first bring up an article, and the article is in one of our progressive independent media rags titled "Trump Administration Plots Massive Budget Cuts That Would Destroy Public Health." You can read that article in Common Dreams. And Common Dreams is one of these independent rags. And again, all of us that are doing independent media, we also feed off of what good mainstream stories are. The Washington Post is now controlled by Jeff Bezos. Jeff Bezos controls the opinion section, and he's given orders that the opinion section can't write about a lot of these stuff. He has not yet completely clamped down on the investigative reporting and those that are doing hard news. But as you all know, if you are working for an institution where your editor or your owner is clamping down on opinions of certain types, when you're writing your stories, you know, even if you're doing a hard information story, you know that you're going to be concerned about what you say. So you're going to be very careful to not hit certain tones. And that is where many of us in independent media would take that info from, let's say, Washington Post, a New York Times, a Floridian, or one of these papers, and add context to the straight reporting. And this is what we're going to do with the story about the budget cuts in healthcare, that too many people don't understand the actual effect of what it will do. So here it goes. The Trump administration plots massive budget cuts that would destroy public health. Trump promised to fight for the working class, but instead he, Elon Musk, and RFK are attacking the programs and services that keep middle class, working class, and vulnerable families healthy in order to pay for tax cuts for billionaires. Under the administration's proposal, the Trump administration is preparing budget proposals that experts say would utterly devastate public health across the United States by eliminating life savings initiatives and hampering key medical research with massive cuts to the Center for Disease Control and Prevention and the National Institute of Health. Have you noticed you don't hear much about the avian flu anymore and all of these other types of diseases? A lot of the erratas and the messages that come out of these different organizations are there no more. They're not coming out. Some of them say they're going to be released on Twitter. It's ridiculous. What that means is you have to take care of your own health right now. You have to make sure and wash your own vegetables, wash it, whether they said it's washed or not, because there's nobody there really helping you out. Under the administration proposal, which has not been finalized and must ultimately be approved by Republican-controlled Congress, the CDC and the NIH would see their budgets cut by 40%. Think about that. We have a healthcare system under stress already, and the CDC budgets to be cut and NIH by 40%. Overall, the Department of Health and Human Services, HHS, would see its budget cuts from $121 billion to roughly $80 billion under the Trump plan. Ellie Murray and an independent epidemiologist warned on social media that a cut that big would destroy public health care. The administration is also pushing to consolidate departments and programs under the newly announced Administration for a Healthy America, an initiative spearheaded by HHS Secretary Robert F. Kennedy, who is overseeing large-scale firings at his agencies that critics says endanger the well-being of children and families across the U.S. Now, that statement is clearly out of, one of these professional news media, where they talk about JFK firing staff. JFK ain't firing a damn person. JFK doesn't know what the hell's going on inside of the HHS. All of this has been documented in Project 2025 as about cutting all these governmental services. That's where it is at. And they are working above and beyond JFK. JFK doesn't know what's going on. Every time JFK goes for an interview, they said, "Did you know you cut this?" "Oh, I'll look into it. I'll look into that." JFK is not doing the cutting. All of this stuff is on autopilot from Project 2025. When we spoke about Project 2025 before the election, people said, well, Donald Trump said he's not doing anything about Project 2025. Now his Project 2025 main author runs OMB. I'm telling you, folks, they don't have a problem lying to their people. They don't have a problem lying to their people at all. They just go ahead, lie to you, say we won't do it, and then they go ahead and follow the plan. Donald Trump has nothing to lose. Donald Trump is going to do one of two things. He has one term left in which he can do whatever. He doesn't have to run for re-election at all. So he doesn't care what he does. He just needs to support his friends so that if he leaves office, his friends will be there to pay him back for all the billions that they get channeled to him. But if the opportunity arises for him to call martial law, he can stay into power, and he believes he can stay in power that much longer because he has a non-functional Congress that refuses to hold up Article 1 of the Constitution. CNN noted that as part of a sweeping attack on public health agencies, a proposal eliminates CDC's Global Health Center and programs focused on chronic disease prevention and domestic HIV/AIDS prevention. While some agencies' work would be moved into the new AHA centers, programs on gun violence, injury prevention, youth violence prevention, drowning, minority health, and others would be eliminated entirely. The proposal would also eliminate a number of what? Rural health programs at HHS, including grants and residency programs for rural hospitals and state offices. Do you know how difficult when these doctors get out of their, training or looking for residencies? Do you think one of their first places is Timbuktu, Texas, or Timbuktu, Montana, or Timbuktu, Nebraska, or Timbuktu, North Dakota? It isn't. There are incentives for these folks to go to these hospitals. There is a reason there are incentives because people don't want to go there. So the government helps out and they help out the private sector to get people into places that they otherwise wouldn't go. You're not going to move all these farmers and ranchers and roughnecks to the cities. They neither want to move there, nor is there much for them to do there. So we have been subsidizing our government, even as many of these people claim to hate government because much of the times they don't know how subsidized rural America is. Trump is finding that out, that in order to make all these cuts into social programs, the people that are going to get affected the most are rural Americans that live in rural areas. So if you're not going to cut the Pentagon budget, if you're not going to stop building bombs, if you're not going to stop building F-30, whatever, that 35s that are not necessary, you are going to have to cut somewhere else. And the only other place to cut are these social programs that mainly go to rural America, the base of the Republican Party. And that's what they're doing. They don't care about you. You don't matter because after all these cuts, the sole purpose of these cuts is to ensure that they can use reconciliation, the budgetary process, to give this humongous tax cuts that will go mostly to wealthy people. Folks, this is just numbers. These are just statements of fact. Okay. Thomas Forley, a pediatrician and public health researcher, called the proposal a bloodbath and highlighted what he calls stunning examples of the kinds of initiatives in the administration's crosshairs, including the National Center for Chronic Disease Prevention and Health Promotion and newborn screening programs for genetic diseases and hearing loss. And again, remember, we're a first world nation according to our own government, but our mortality rate among mothers, our birth mortality rate way exceeds even Cuba. Actually, Cuba has it very well. Cuba has one of the best healthcare systems, not using all these fancy things, but they have sure known how to keep their people healthy. Nothing fancy, just care. Every country from Holland, meaning the Netherlands, to Denmark, to France, the care that the average citizens get much better than we get here. Now, if you have a lot of money in America, nobody can beat that. But if you are just the average American citizen, working class, middle class, your healthcare sucks because all the monies actually go into the pockets of shareholders and the execs and others who own these hospitals, who owns the doctors. And notice what I just said, who owns the doctors. Many doctors' practices are being converted into venture capitalists purchasing these places and then rehiring the doctors to work. And they must see X amount of patients per hour. Understand what's happening here, folks. Call your representative. That is what you have to do. It hasn't happened yet. It has not happened yet. People still have power. You still have power before the system is corrupted. And notice what I said, the system, because what they're going to do is decimate the system. And when people start to complain, then they'll start patching the system in with private actors to come in, and you pay more for private actors than it would in the system, because the private actors maximize their own monies. They pay little wages, but they maximize the profits for their shareholders and bonuses for executives. If these folks continue to work within the government strata, guess what? It's not for profit. They make better salaries. They get better incomes. They get better benefits. And your entire neighborhood, your entire society, because we have those workers that are paid well and providing you good services, it makes a more vibrant economy for you. So this is multifaceted, people, multifaceted. Rural hospital flexibility. This is what they're eliminating. And I need you to have this list ready. It's at politicsandright.com/newsletter where you can find the article. But these are all the things that are going to be eliminated. Listen up, rural America. Here it goes. Rural hospital flexibility grants, gone. State Office of Rural Health, gone. Rural Residency Development Program, gone. At-risk rural hospital program grants, gone. Family planning, gone. Hansen's Disease Facility, gone. Youth violence prevention, gone. Adverse childhood experiences, gone. Firearm injury and mortality prevention research, gone. Traumatic brain injury, TBI, formerly in the CDC, gone. Drowning, gone. Elderly falls, formerly in the CDC, gone. Other injury preventative activities, gone. Injury control research centers, gone. These things didn't come into power because they didn't come into being just out of the blue sky. They came into being because a need was found that these things would help people, and specifically where it was needed most, in rural areas. You know where most of Biden's infrastructure and CHIPS and Act monies went? Red states. You know why? Because they were the most needy. They continue to be the most needy. And what are the things that Donald Trump are planning to cut? Because again, if you're not going to cut the defense budget, all those things are the only places he can find enough money to cut. People, I need you to forget about your ideology. I need you to forget if you're MAGA. I need you to forget if you're a Republican. I need you to forget if you're a Democrat, independent, or whatever the hell you are, and start considering yourself just an American, a working class, middle class, fairly high class American, because all of these things are coming after you. They're not coming after you because they don't like you. They're coming after you because that's where they can take back the monies. Already we are underpaid. That's the reason the wealthy has what they have. That's what's called excess labor, excess value. They take your excess labor, your excess value, and they pocket it because they control. And we don't yet have the regulations, the unions, and all the structures to ensure this doesn't happen. But you still have the power. It's not gone yet. It is going if you don't do something about it, but you still have the power. You have a congressperson that if enough of you call the congressperson, if enough of you show up at that office, and I'm talking about all of you, whether you're MAGA, whether you're Republican, whether you're Democrat, all of you, I don't care if you're in a red district, blue district, I don't care where you are. Pressure these guys into supporting you. And it is, you can't sit back and do nothing. Because there are others doing something. There are others doing something. And those that are doing something are not doing the something for you. They're doing the something. Those lobbyists, etc., they're working for that guy who wants those billion-dollar tax breaks. I'm working with lobbyists in Washington. There's this friend of mine. He's living in a basement in Washington. He goes up to Capitol Hill every day lobbying for healthcare. He has a hard time actually seeing the congressperson speaking mostly to their staff. And this guy is living off of the support of whatever people would give him. A lobbyist living in the basement. I know about 3 or 4 of them living in basements in DC, going up to Capitol Hill, getting a quick shower, putting on a tie and suit, and going up to Capitol Hill every day. Folks, it's on us. It's on you. You don't let things happen to you. You don't let things happen to you. You ensure that only good things happen to you. And right now, it is true. They're getting ready to decimate your healthcare. They're getting ready to decimate your FAA. They're getting ready to decimate all the things that there were reasons why they came into being. There were reasons why these agencies, why these sub-agencies were created, because they were needed. Is there fat in the government? Yeah, go to the military-industrial complex. Go cut those budgets. Go cut those budgets. Folks, it's on you.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.